working with people who have anal fissures for about 15 years. And the kind of suffering that comes along from anal fissures, as those of you who have anal fissures know, is terrible and can be excruciating, and it could stop you from living your life. So we put together a program based on 15 years of clinical experience that works. An anal fissure is a tear in the anal canal. Mostly it's in the posterior anus. The symptoms of an anal fissure are bleeding and sometimes excruciating pain, but almost always some level of pain, and the pain is often worse after a bowel movement. The causes of anal fissures vary. Often constipation, hard, dry stools that are too large coming through the anal canal cause the anal fissures. About 1 out of 10 childbirths result in an anal fissure, and this anal fissure healing kit is very safe to use while nursing. Anal fissures are very common. One of the elements that comes along with an anal fissure is embarrassment to talk about the fact that you have an anal fissure. So know that it's actually very common and it's great to talk about it. Oftentimes a person can't heal until they start talking about it because they can't figure out a solution. Many people find it very hard to heal from an anal fissure and are faced with surgery, Botox injections, these sorts of things. And what I want you to know, again, is that with the program we've laid out here at the Optimal Health Network, you can heal. It's 100% successful with everyone that I've worked with so far, and it causes no side effects. The treatments that the medical community offer often can work well, and often they don't work well. So for instance, with the nitroglycerin ointment, there's only about a 50% success rate with that, and often it can cause headaches. The treatments that we're offering, they don't have side effects and they work. I'm going to read a testimonial to you here about a client who's worked with us, and this is very common. I have lots of testimonials coming in every week about people recovering from anal fissures. I've been suffering for the last 4 years with an anal fissure. After trying everything, including Botox shots, my only remaining option was surgery. My sister recommended your website, where I ordered the anal fissure healing kit as a last resort. After less than 1 month on the health plan and weekly enemas, I have zero pain. So you can heal using our anal fissure healing kit. Internal sphincterotomy has the risk of incontinence, and especially as you age over time, both with stool and with gas. So try everything before you have that type of surgery. We put together an anal fissure healing kit that will heal your fissure. The kit regenerates and restores the skin, the elasticity of the anus. It reduces inflammation and bleeding. It increases blood flow to the area, and it eliminates the need for surgery. For some, just using the super salve is going to be enough. It depends on the severity of the fissure and how long you've had the fissure. So if you're limited in your income, try the super salve to start with. If you're not seeing the results you're looking for within 5 to 7 days, you're going to need to do the whole kit. In addition to the super salve, the anal fissure healing kit has my book 10 Days to Optimal Health, which is going to guide you through the dietary changes that may be needed to heal from your anal fissure. For instance, reducing your carbohydrates, eating more high quality proteins and healthy fats. Also, we have a probiotic in the anal fissure healing kit, which is going to optimize for a certain kind of health promoting bacteria in the colon. We have a magnesium in the anal fissure healing kit, and what that does is that softens the stool, so there's no chance of hard, dry stools. And we have MSM, which is a supplement that reduces inflammation and increases healing in the body. We've developed this unique blend of 8 Young Living essential oils to help restore the elasticity of the anus and to prevent infection and reduce inflammation. Included in the kit is a suppository tray and coconut oil that you can use to make your nightly suppositories. Given that poor healing of the anal fissure can be due to constipation or hard stools, it can be really important to use regular enemas for the healing of the anal fissure, which is why we have included an enema bag. If you need more help about how to take enemas or what to put in your enema solution, you're going to want to see these videos, how to take an enema and the enema series. Using filtered water is just fine for removing stool. But if you want to optimize the health of your colon, you're going to want to also get the items for the enema series. We have an upgraded anal fissure healing kit that includes the needed items for the enema series. As you heard in the testimonial, healing can be quite quick with this anal fissure healing kit, yet you may have to continue using some of these tools because you don't want a reoccurrence of the anal fissure. So for instance, you might want to use the super salve for 2 to 4 months, or do the suppositories 1 to 4 times a week for 2 to 4 months. I promise you that this program will work, and if you have any troubles with it, you can give me a call at the Optimal Health Network or email me and I can help you with it.